I'm Brian LaCroix from Allina Health EMS. The intersection of excellence is modeled after the work of Dorothy Del Bueno, a nurse and educator. Bringing together the three critical pillars of technical skills, critical thinking, and interpersonal skills separates good providers from those who are truly exceptional. I'm interested, as you know, I've chatted with you earlier about this idea of an intersection of excellence, if you will, the idea that really good EMS care providers have more than just technical skills.
Anybody can learn the skills, but you put that in concert with a good attitude, good communication skills, as you have pointed out, critical thinking skills. Combine those all into one, and you have a fantastic service provider. Both with, and really in any job that you do, if it's after the fire or if it's after the cardiac arrest, if it's during the transport, you have to communicate with those patients, with those families.
The Allina crew was very receptive to what the midwife was telling them. And she said that this has been the best group of paramedics that she's ever worked with in her whole career.
The paramedics took vitals of both mom and baby as they needed to, and I'm not sure to what extent or what exactly was done, but they had a laptop deal type thing out, and I'm guessing blood pressure and pulse and
they did her APGAR score, and they scored her a 10.
Well, thank you so much for sharing your story. It's a great outcome, and sounds like a good experience, even though it took a couple of twists along the way.
The biggest thing is, there's the clinical importance of making sure I was taken care of, my needs were being met as a patient, but my wife is every bit as much of a patient as I was, and my children too, and making everybody a part of it made it easier on me and easier on them. Later, the very first one was when I was still in the ICU, when I just woke up. They were doing their rounds, and they were talking about the surgery they had to do through my pelvis. And there's residents at that hospital, it's a learning hospital too, and they were outside the door talking about the surgery. Okay, what would you do? One of the person talks about this. Wrong, you'll kill him, he'll die. Next. And they're being blunt with them, but I'm sitting there going, I'm gonna die. Yep, this is it. I lived through this blast and they're gonna kill me in the operating room. And all this stuff. Nope, you can't do that, he'll be paralyzed. So finally my wife went out there and she's like, are you guys out of your mind?
So if you could rewind this tape and meet those paramedics at the door and give them a little advice about how things could have been done differently, what would that look like?
My advice would be, first of all, to recognize that the patient per se isn't the only person on the scene and isn't the only person who needs your help. And to pause and observe and respond to what they see more fully, to recognize that we as parents need their expertise. We may even need some of their reassurance, and that's a huge part of the value that they can bring to that scene.